lecture today where we will be talking about how to place a Swan-ganz catheter. In order to get a Swan-ganz catheter, you have to be prepared with the materials that you have. First of all, you want to make sure that you have the introducer sheath, which is 8.5 French, and then you want to make sure you have your Swan-ganz catheter. Here you can see Swan-ganz cardiac output compo, and that's a 7.5 French, so it will fit into the 8.5 French sheath. For you to have a catheter in the PA and an outlet in the CVP, you are going to need 2 saline bags, and you're going to need 2 pressure transducers. This is how the sheath will look that you will use for the right heart cath or the Swan-ganz. Again, it's 8.5 French. I want to show you the other sheath that you should not be using, which is a smaller sheath, and this is a 6 French. You can notice the difference that this is a smaller sheath in comparison to this one, which is a bigger sheath. And now we can see that if you try to put the right heart cath in the smaller 6 French sheath, it's not gonna go, it's not gonna pass through, because this is only 6 French. While if you try to put it through the 8 French, 8.5 French, it's gonna go easily. So this is the setup for the sheath. You have your needle and you have a syringe, and you have your wire, and you have your 8.5 French sheath. Remember that for those sheaths, you should have the dilator prepared before. I always flush this hub and get a cap and put it on this end, and I usually just keep a saline syringe on it so that it will be easy to flush it later on. In order to do this, you get your needle, you expose the needle, and imagine if this is the I'm getting access through the internal jugular vein under ultrasound. All right, you take this out and you get your wire and you thread the wire all the way to the end. Okay, at the end you'll end up with a wire. I usually use a scalpel to create a small nick in the skin to make it easy for the sheath to go through. Always make sure before you even insert that your sheath is locked in. The sheath cannot be like that, because then once it hits the skin, it will go backwards and you will be dilating the skin through the sheath, which will not work. So make sure it's all the way in, and you will feel kind of a click once you have it in your hands. And this will be the dilator. So if you did not create a good nick in the skin, it will be very difficult to go through the skin with this bigger sheath. So always try to create the nick and then do a screwing motion like this. Once your sheath is in all the way, this is what's different than the central lines. You will take the dilator and the wire out both together. And now you have your sheath in. You can draw some blood and flush, make sure everything is okay. At this point, some people like to suture it to make sure it's secured. You can suture it through this hole to the skin. Some people will just keep it and they suture at the end. While you are preparing for the sheath, your nurse should be starting to prepare for the pressure bags. For the right heart cath, you need 2 pressure bags and you need 2 pressure sensors. And as you can see in here, it's very crucial to label the sensors. One of them is going to be PA and the other one is going to be the right atrial or the central venous pressure. Then you will end up with 2 tubes. Also, it's very important to label the tube. So this yellow one is the PA and the other one is the right atrial or central venous pressure. Once the pressure sensors are connected to your monitor, you can verify if you have labeled them well by shaking any of the wire and see if it correlates. So this one is the yellow one. Let's make sure that is connected and showing the PA pressure. You should also check the CVP line or the RA line, and again you can wiggle it and see and make sure that it correlates with what you have in here showing CVP. Now the numbers are wrong because this is artificial wiggling and it will create, havoc for the monitor. So this is the Swan-ganz combo. I want you to recognize that there are two areas to open this package. There's a smaller area and there's a bigger area. I would recommend that you start by opening the smaller area, and once you open it, you will see that this will expose your connections. And then you'll be asking your nurse to connect those connections to the monitor that she has. Recognize that I have not taken the Swan-ganz out of this because it's still clean. Now this side is gonna become unsterile because your nurse is gonna help you to do the connections. Let's start with the yellow one. The yellow one will be connected to the PA connection that we just did over the pressure bag, and then the nurse will flush it. And then the blue one is gonna be your CVP, and you will connect it to the CVP, and same thing will happen, flush it. The red connection is connected to this syringe for the balloon, and we will talk about it later. And then there are three other connections. One of them is blue and the other ones are capped. The blue connection is for the SVO2, so it will measure the venous oxygenation, and you will have to hook it up to this device, and you should be hearing a click. Good. Now there are two more connections to do. One of them is the blue and they're all color coded, and the other one is the white. And you want to line it up, and then you have to turn it clockwise. By this, we have placed all the connections together. Now, before you start, you want to do some calibration. So you can go to the SVO2 over here, click, and this will show you a menu. And from there, you can do in vitro calibration. This means that the catheter is still in, and we're calibrating it while it's still in vitro rather than in vivo. If the in vitro calibration does not work, then you will have to do in vivo calibration. After your connections are ready, you should make sure that the lines are accurately zeroed. And what we do, you pull up the sensors to the level of the heart of the patient. So the heart has to be at the same level. And this is how we zero. So first of all, you want to close it, and then you open the cap, and then you do the same for the other one, and then you have to flush it by pressing here. That will give some fluids out, and then you go to your monitor and you press this button that says zero all procedures, and now both the PA and the CVP will be zeroed. After you confirm the zero position, you go back to your sensors and you make it look towards this way, so this outlet is closed and the pressure will be reading through the vertical. Same thing for the CVP. It would be nice also to close them after you're done. Your balloon is down. You want to insert it. What I usually do is, after I have a couple of centimeters out, then I hold it and I expose it. It just makes it easier. And then this makes sure that all this catheter all the way remains sterile. Even if anyone wants to touch this area, it's okay because this catheter and inside of it is sterile. The way that I like to insert this is, imagine if you have your sheath over here. I don't like to advance it through this one. It might be difficult at the beginning through the cover. So what I do, I just keep a couple of centimeters out and I put it through. And you can see, once you put it through, it will start exiting the sheath. This is a demonstration if you have the sheath over here. Once you start inserting this, look for the markers like this one. Once you see the first marker out and you reach about halfway through the coil, you can go ahead and inflate your balloon. And in order to do this, you want to make sure that your balloon is open, inflate, and lock it. So now we have the balloon inflated and then it goes down. The balloon will prevent you from puncturing the ventricle and it will keep the catheter floating. Now unfortunately this balloon has ruptured because of using it multiple times, but imagine if it's floating. Then you will see that it goes down straight, and then once it reaches the right ventricular wall, it's gonna turn around and it should adopt the shape and end up in the right pulmonary artery. You are doing this while you're looking at the pressure monitor, because once you get to the RA, you will have a different wave than the RV and ending up with the PA. If your balloon is inflated and if you end up all the way in the pulmonary artery, this will wedge and the waveform will change. And this is how you know that you are actually in the pulmonary artery and you ended up in the wedge position, showing the pulmonary capillary wedge pressure, which is an estimation of the left atrial pressure. After you have inserted the right heart catheter or the Swan-ganz catheter and you're happy with your position, look over this cover and you can see that there's an area over here that has a notch, and you can actually put this notch through and then you can turn it a little bit. That will make sure that this tip is connected to the sheath. But there is also another locking mechanism, and you can see that here there's number 1 and number 0. Number 0 means it's free, but when you rotate it clockwise to number 1, basically this puts tension on the catheter so that it doesn't move. Same thing applies to the end of the cover. You can see 0 means no tension. I can still move it, but then once I clock it, it really becomes so rough you cannot even move it. And this is how you make sure that your catheter will stay in place. If for some reason you don't need the Swan-ganz catheter anymore, but you still need the sheath in for IV access, always look for this cap, the blue one, because you can use this one to lock, to put it on your sheath and it will lock it. See, this has no outlet, it's just closed and covered.